Have you experienced vague knee pain that started without any injury and it feels like you want to have some sort of relief to pain somehow? Can you tape your knee? Of course you can. This is such inexpensive treatment experience that it only costs few euros. Just the price of this traditional sports tape. If, for example, you need to adjust the load of the knee due to osteoarthritis or wrong knee, the easiest way is through the slight rotation. Which of these rotations ease your symptoms more? Typically, small change in rotation can affect the knee function in a way that the familiar symptoms begins to ease. And when the symptoms are gone, there is no need for taping anymore. Just enjoy your active life. First, we'll go over the less common taping technique that helps some, but through the small adjustments, the final knee taping method seems to be working amazingly well. So be sure to check both versions so you know what's worth trying. Start by standing with your weight distributed evenly to both legs. Then step forward with the leg on the affected side. Keep your knee straight and rotate your foot slightly towards the body's midline, about 20 or 30 degrees. After this, bend your knee a bit and then rotate your thigh outwards. Find the large bony bump in the top of your shin bone. That's where the quadriceps muscle attaches. This will be the starting point for the tape, and from there, guide the tape towards the inner side of the knee, around the back of the knee, and wrap it all the way to the outer thigh. Make sure that the tape doesn't cross the knee crease horizontally. It tends to bunch up at that height and it could easily wrap the skin raw. Always overlap each strip of the tape by 50%, so one tape strip is halfway over to the other. You can start with 3 or 4 strips and then add support tapes around the shin and the thigh to prevent the tape from rolling off. Here is a little example of the taping before adding the support strips. How does this affect the knee pain what you are feeling? Next, try this. Again, stand with the weight evenly distributed to both feet. Then step forward with the leg on the affected side. Keep the knee straight, but this time rotate your foot outwards, away from the midline of the body. Good starting angle is 20 to 30 degrees. After that, bend your knee slightly and then rotate your thigh inwards towards the body's midline. Find the large bony bump at the top of your shin bone. This is the starting point for the tape, and guide the tape around the outside of the knee, cross the back of the knee at diagonal, and when you reach the inner thigh, cut the tape. Again, overlap of the strips halfway and use 3 or 4 strips of the tape. Here is another example of what the knee looks like before adding the support strips. After that, apply the support strips and test how it affects your knee pain. If you want to know more about the knee osteoarthritis, check out this video and feel free to share this video with anyone who has knee problems. Thank you.